Welcome back to the podcast. We are no longer Aesthetic Chat with Kiki, but we are Aesthetic Chat Unfiltered. I am still your host, Kiana Gamble, and excited to welcome Gab Major. We all know her from Instagram. We love her, and I'm so excited for you to listen to this episode. So enjoy. All right, everyone. We are back on the podcast. So she's going to introduce herself and just share a little bit about her. And we're super excited to have her on the podcast.
Yeah, well, thank you so much for having me. I am so honored and excited to be here. My name is Gab Major. I am an aesthetic injector. I'm a trainer. And very recently, I'm the founder of May Aesthetics. I started my aesthetic medicine career working in plastics. So my foundation is very rooted in surgical aesthetics and facial anatomy, and working alongside a plastic surgeon was incredibly valuable and, really where my appreciation for anatomy developed. And, being in that environment taught me to understand the face structurally, see how everything connects, and appreciate all the small changes that can have a really meaningful impact. So yeah, that experience really shaped the way that I approach aesthetics today, with a strong focus on safety and balance and long-term outcomes. And then from there, I transitioned to injecting full time, which is really where a lot of my growth happened. I had the opportunity to treat at my last practice a very high volume of patients. So I got a lot of hands-on experience, which allowed me to practice, consistently and refine my technique and develop my eye. I also invested heavily in my education during those years. So I probably made no money. All of my money went to trainings, but it paid off. And now I am about 2 weeks out from opening my own practice, which has been incredibly exciting and very full circle. So yeah, that's a little bit about my background and where I am today.
How exciting. So actually, I saw that you were opening your own practice, and I thought it was the perfect time to actually bring you on to the podcast. A lot of the podcast actually has shifted more towards like clinical entrepreneurship and being an injector, yes, but the other opportunities that we do have as an injector. So, kind of going back a little bit to your background. So, how long were you with the plastic surgeon's practice? And then how long were you with your last practice? So, it sounds like you've been with two different practices total.
Yeah. When I was with the plastic surgeon, I was living in DC and I was with him a little over 2 years. And personally, at that time, I was moving back home to Pennsylvania. So I moved back home and then got a job at my last practice. And I finished, last year there, but I was there for a total of 4 years.
Thinking back to kind of all of the experience that you've had and looking at where you're at today, was owning a practice ever on your radar? Was that something that you were like, one day I want to be a business owner? Or has all of your experience just accumulated into, okay, now I think I'm ready?
That's a great question. So yeah, it actually was. Both of my parents have owned their own businesses for 30 plus years. So I come from a very entrepreneurial family. So ownership was always something that felt really natural and familiar to me, even though it's very, intimidating at the same time. And I actually named my new medical aesthetics practice after my mom because I've always really admired her journey and her work. And so there's a really personal component as well. But yeah, for those reasons, establishing my own practice was always something that I thought about inherently. I just didn't know when I was going to wake up and know that it was the time or if that was going to happen. And it did. So yeah, I wasn't sure on the timeline, but it was always in the plans.
And if you don't mind sharing, could you kind of walk us through some of your thought process when it came to trying this to decide when was the right time for you? Was it something where you finally woke up one day and you were like, I'm going to open my own practice? Or were there specific things that kind of were shaping that?
Yeah, professionally, I had reached a point in my career that I was super proud of. But at the same time, I had and still do have a lot on my plate. So I'm currently in school to finish my master's. So I'm getting my FNP. I start my clinicals this year. So my schedule is a little bit all over the place. And over the past few years, I've leaned really heavily into education. So I teach and I train and I travel quite a bit for that as well. So I think it was a combination of all those factors and feeling like I needed to have just a bit more control over my schedule and how I was spending my time. And so although I did take on a whole other project, but opening my own practice really
Yeah.
has allowed me to create a structure that works for both my patients and works for where I am at this stage in my career instead of kind of trying to fit into somebody else's framework. And honestly, I mean, my patients were a huge motivator as well. They are so amazing and loyal and trusting. And that in itself was enough of a motivator to realize that I've curated all these incredible relationships and I'm young and I have a lot of gas in the tank and I don't have kids. And now is the time to take the leap. And it's been truly one of the best decisions I've made for myself.
That is so exciting.
Mm.
Congratulations. In terms of buying back your time in a sense, and I'm sure you've already felt this, like a freedom and a lift off of your shoulders, being able to schedule your patients when it works best for you, as you know, headed into clinicals, you don't get a lot of say when it comes to maybe your rotations or what days you have to be in the clinic versus what you can't. And what I will say is, like, my patients were amazing about it. Every quarter, every semester, I was changing kind of when I could see them, how I could see them. So getting that opportunity to have that flexibility, decide when you're gonna train versus when you're gonna be in the clinic versus when you're going to be at clinicals. From someone maybe watching this, they would be like, "This girl has so much on her plate already, why would she add something else?"
Mhm.
But there's a freeing aspect in that you get to dictate exactly how your time is being spent versus someone else saying, well, no, you're actually supposed to be here Monday through Thursday or Monday through Saturday or every other Saturday. And that's not going to work for us, you know?
Yeah, and I mean, even logistically, my previous practice, I was driving about an hour to work, so that took up so much of my time, and I did that for
Hmm.
4 years, and now my practice is 8 minutes from me, so I can always pop in and see patients whenever they need to be seen, and I can work weekends, and I can work evenings, and again, I'm really early in my career, and I have, like, the energy and the motivation to do that, so it just kind of all fell into place, so I think all of those things did contribute to me kind of waking up one day and being like, it's time, like, I'm doing it.
Amazing. I didn't actually realize you were in FNP school actively. So tell us what program you're going through and when you'll be finished.
Yeah, so I'm online at Walden, which has made it really I mean, they're super flexible. All of my work is online. So again, I can kind of set the days and times that I'm going to sit down and study. And I'll finish this year, so I go through all of my clinical rotations this year. I have 4 rotations, and then I'll graduate, yeah, I guess the beginning of next year. And again, I mean, it doesn't really change too much about my role. A lot of my patients are like, are you not doing this anymore? Like, are you going into primary care?" I'm like, "No, it's just, it's something I've always wanted to do, and again, it's just the right time. I have the energy and I have the flexibility to make it work. So although it's a lot, I'm making it work."
And not familiar. So in your state, is it full practice authority for NPs?
It's not. So I'll still have my
Okay.
medical director who is incredible. But it'll help me with my good faith exams and it'll help me. Who knows if the laws will change? I mean, there's a lot in this field that's constantly evolving and changing. So I want to be as proactive as I can. And some states you do have to be an NP. So if I am teaching and training and I'm going to a state that I need my master's, I want to have that and I want to set myself up to have a really long and successful career. So I gotta do it.
And with your new practice, share a little bit. You told me that, you named the practice after your mom, which is great, but share a little bit about kind of how your past experiences have shaped the experience that you're giving your patients at your own practice.
That's a great question. Um, yeah, I mean, being an employee is so incredibly valuable. It gave me the opportunity for a long time to focus purely on being a provider and being the best injector that I could possibly be without having to split my attention between patient care and running a business. Again, I was able to see a high volume of patients and focus on that provider side of things. And I love that. I really, really do. I love being with patients. I love performing treatments. Like I just love being in the room. So when I decided to open up my own practice, it was really important for me to not lose myself in the business side too much. I wanted to maintain that same level of patient experience and accessibility. And although being a business owner is incredibly time consuming, I really wanted to be in the room and I am. So that's one of the reasons I'm okay. I'm in a suite right now, which I'm like slightly self-conscious about because everybody has these like incredible massive build outs and who knows what the future holds, but for now it allows me to have a quieter environment. It's very private. All the appointments feel really intentional. It doesn't feel transactional or rushed. And my patients love it. I prepare everything in the room in front of them and we have time to consult. And I truly, truly am so happy I went this route But yeah, I wanted to be able to prioritize that patient time the same way that I was able to do that when my primary role was being a provider.
That's great, actually. So I think that this is not what I was going to actually talk about on the podcast with you, but I think it's something important to speak on. So, for context, lots of people know that I don't have any staff with me. It's me, myself, and I at my practice in Coeur d'Alene. And then I'm currently opening a practice here in Scottsdale, Arizona. But with
Congratulations.
that, thank you. But with that being said, in Coeur d'Alene, it's just me. Like, I don't have any other staff. Like, I check you in, I do your photos, I do your treatment, I check you out. And my patients really do love that aspect of, boutique style is what I like to call it. In Scottsdale, I was trying to do something very similar because I do have my own office. But here, in terms of real estate, it was really hard for me to find a location that wasn't crazily expensive or didn't need a full build out. So either it was an empty shell or it needed completely remodeled. I don't want to spend $500,000 on a build out right away. It's daunting, it's scary, and at the end of the day, it's just not the smartest thing to do right now. So right now I'm working on getting a little salon suite ready in Scottsdale. I'm going to run out of there for about a year, maybe 2, as I try to find the perfect space and be patient with myself. But I can completely relate. So I've been injecting 5 years now. I'm very confident in my skills. I know I can provide a great result and I love what I do. But you do see all of these people that are opening massive conglomerate practices right away. They're doing the full build out, which is amazing for them. I love that they're able to do that. But that's not everybody's reality. And nor is it the smart thing to do necessarily right off the bat. So I do think that that's something important to say that, I don't think that we should feel self-conscious in an aspect of doing what's best for our patients, what's best for us from a business perspective, as well as I think that it's not said enough that part of that growth journey is you don't get the 5,000 square foot beautiful, amazing office right away, you know?
Mhm.
Like there are steps and levels to the game, and we're just kind of at the very beginning of our entrepreneurship journey, and that's okay. So,
Yeah. Yeah, totally. And, I think being the person that is in contact with the patient from the time they inquire to the follow up, and it's really valuable and patients appreciate it. And I feel comfortable from a business standpoint having my hands in the pot in everything. Like, I want to set up the booking software. I want to be the one looking at the numbers. I want to be creating the consent forms. Like, because then we can kind of understand everything about the business and then hire and delegate out. But I don't want to delegate something to somebody right off the bat and then maybe they leave or they move and I don't know how to do it and I'm left to pick up the pieces. So I think it's super valuable to, as much as you can handle it, be involved in all the parts and kind of know things from the top down. And then as you hire, you can niche down and delegate out what you can.
exactly. And too, with my practices, I do find that because I have my hands in everything and I do understand exactly how things need to be done, I can really set up my systems and ops before I hire someone. And so it's not trying to build the plane in the air. I'm really
Mhm.
trying to be intentional and trying to find the right people to hire. So I am finally at the point where I'm like, hey, maybe I should hire like one person just to help like offload this or offload this so I can, see more patients. But it does allow you really time to be very, very intentional, as well as at the end of the day, like your patients don't care. It's all about the relationship that you built with them. And the feedback that I've gotten coming from, a really large practice where there was a bunch of people and a bunch of hands in the pot and they would see so many different faces. They kind of like that it's a little bit more quiet and, just
Yeah.
feeling less rushed.
Yeah, I mean, it's a vulnerable experience for patients. So if you can make that relationship as, private and trusting as possible, they love it and they really appreciate it. So yeah, I'm totally on the same page, and I think when you're gonna love it. I mean, it's awesome.
Yeah, that's awesome. So, as you're about to open, you said you're going to be starting to see patients here in the next 2 weeks. What does your book of business look like? Is it primarily, have you taken majority of the patients that you had back at your old practice in terms of, you built up that patient load 4 years ago and now you're going to be continuing to see those patients? Or do you have room for new patients?
Yeah, and sorry, I worded that wrong. I opened about a week and a half ago, so
Oh,
I'm almost
okay,
2 weeks.
okay.
Yeah, so I opened last week. I worked all last week and it's busy. I mean, the first day I felt like a chicken with my head cut off a little bit just because I'm not used to doing all of those admin things, checking patients in, checking them out, and booking them and payment. So finding my flow took a day, which I'm appreciative it only took a day, but things have been great. Patient wise, again, I feel so blessed and lucky to have such a loyal patient base. So it wasn't something that I had really reached out to them just for legal reasons, but I put the word out there that I was opening and I was going to be providing the same care in a different place. And I had an online booking system again, which I find super valuable because I don't have the time in the world to be, sitting and doing emails and booking people. So having that like self booking platform set up has been game changing. But yeah, tons of people booked. I'm booked out for like the next 3 months, which is amazing and I was not expecting.
Yay.
And I do have new patients, and I love seeing new patients, and I hope I can always see new patients. So yeah, it's a really good mixture. I say it's probably 85% existing patients. But yeah, it's been incredible so far. I'm so excited to see, what this next year looks like.
It's so exciting. I think that there is a lot to be said, I know, and you did touch on the fact that it is so valuable to be an employee first. Again,
Mhm.
you got that clinical confidence, you had built a relationship with many patients, it sounds like, and now you're at the point where you can kind of, I don't wanna say switch gears, but you can take some of your focus and put it on, the business ownership side of it. So, that's amazing and super exciting.
Thank you.
Anything specific while you were in the process of getting everything up and running that surprised you? Like, that you were like, "Wow, I never thought about this," or, "I didn't expect this to be maybe harder than I anticipated." What came up for you during that process?
That's a great question. Right off the bat, I was very honest with myself in that I was not so knowledgeable about what went into, I guess, the legal side of owning a practice and having a medical director. So I hired a great lawyer off the bat, which was incredibly expensive, but it was so worth it. Those meetings, I learned a ton. It was really eye-opening, but I am also so lucky that I put people in my corner too. Like I got a great lawyer, I have a great accountant. So even though I don't have clinical staff or a patient concierge or a medical assistant. I have great people that are in my corner that want to see me succeed. So that has been amazing. But yeah, all the back end stuff, like the MSO structure and all the contracts, it's very complex and it's not something that I've been exposed to before. So reading through hundreds of pages has taken a lot of my time. And I've learned a lot. But again, it's part of the process. And I'm sure there are going to be new things that continuously come up that I'm unfamiliar with. And you just kind of have to take it and move on. But yeah, I would say all that stuff, all the contracts and all the back end legal pieces to make the business compliant has been super eye opening.
Well, I'm so glad that you have outsourced it and you
Yeah.
have used the people at your disposal. I think that isn't said enough as well, is, having those people in your corner and reaching to them when you are out of your scope of you're like, I don't know how to set up a legal contract. I'm not quite sure. Also, accounting is a whole nother beast in itself. So yes, I do have a bookkeeper as well because it just makes my life a lot easier. And so, yes, trying to find those people that, again, are looking out for you, are reading your contracts, are making sure that from a legal standpoint, you don't want to build this amazing business and realize that you're vulnerable at all different angles.
Yeah, totally. Yeah. So that has been, I completely agree. Yeah.
So let's switch gears a little bit. Let's talk a little bit more about you and kind of training. So, in your new space, are you going to be hosting private trainings in your practice? Or when you say training, are you primarily training with Galderma and going to other people's practices?
Yeah, a little bit of both. I would say primarily Galderma. I didn't realize how quickly that role would grow. Galderma has been such an amazing company to work with. I became a trainer in September of last year. And within the first few weeks, I had like 12 trainings scheduled, which I was not expecting at all. So yeah, I didn't realize how quickly that role would grow and take over the training aspect of my job. And it's really cool because I truly love Galderma's entire portfolio. So it's a really authentic relationship in that way because I genuinely believe in what I'm teaching and the tools I'm teaching with. It never feels like I'm selling. I'm just kind of like sharing products that I instinctually reach for in my practice and approaches that I rely on. So that makes the education feel very natural and sincere. So to be honest, besides the off label aspect of it, my Galderma trainings and my private trainings are not so different. But I would say I'm primarily doing Galderma trainings. I am doing some at my practice. I primarily travel for those. Like I go to California next week. I'm going to Minnesota, South Carolina. So I have a lot of cool trips coming up. And then I will host some more intimate private trainings at my practice as well. So I love educating, I love teaching, and again, Galderma has just kind of provided another opportunity for me to connect with providers from all over the country, and I'm super grateful.
You are probably the first guest I've had on the podcast that has been introduced as a new trainer with Galderma within the last year.
Mhm.
So, question for you is, did Galderma come to you and they were like, "Hey, Gab, do you want to maybe become a trainer?" Or
Mhm.
was that something where you really put yourself out there and you've been, like, keep me in mind, I
Yeah.
want to be a trainer? For somebody that maybe is listening that maybe wants to become a trainer in the future, tell us a little bit more about how you kind of landed that role.
Yeah, it was a little bit of both. I mean, where I was in my previous practice where it became a really strong interest of mine, I was in a territory that didn't necessarily need trainers because there wasn't a huge market. So it there's a little bit of that goes into it as well, like logistically what makes sense and where do they need trainers. But it was a little bit of both. And I would say kind of like what I touched on already, if you really want to get into the education side of things, just start offering shadowing, start doing private trainings. You don't need a company to sponsor you to train on their products, but it is awesome that I align with their portfolio and I use them and it creates this kind of loyalty that's hard to break. But to answer your question about how it happened, it took a while. I had expressed interest with our rep at the time. Probably, God, I became a trainer in September. It probably was a year-long process. And I think Galderma had the year that I was accepted, had kind of tightened up the interview process. So I met with a few people higher up in Galderma, which I was grateful for a few times. And then I had to submit talking about why I want to be a trainer. I had to submit my resume, a cover letter. It was pretty intense and it took about probably 10 months to a year for everything to go through. So yeah, it's only been however many months now and they're awesome. They've been so supportive, especially coming out being a new trainer and having a ton of trainings. They were awesome.
So, share a little bit in terms of like behind the scenes as a trainer. You said that you're going on quite a few training gigs here in the next couple of months. So, how does that work? So, obviously, I know from like an account perspective, I can say, "Hey, I really want to train with Gab. Like, can you make that happen?" But if they come to you and they're like, "Hey, Gab, like I have all these different cities that want to see you. Can you politely decline, or do they tell you when you need to be there, or are you like, "Hey, like, these dates kinda work for me," and they can kinda work around you?
Yeah, the reps get my contact information from my rep. So if your account representative wants me to come train, your rep will reach out to me. We'll coordinate a date. A lot of times, which I appreciate, Galderma wants it to, be worth your time. So, for example, when I'm going to California next week, I have 4 trainings. So I'm not just going for one. If I'm going out of market to teach, they want it to be worth, the 5.5 hour flight that I'll be taking. But yeah, everybody works with you. So they say, what is best for you during the week or a weekend. Let's find a time, and then every rep is allotted a budget. So if they have it in their budget, they can submit it to Galderma to send me there. And then Galderma they pay for my flight and hotel. It's so nice. But yeah, so it's super collaborative. I can decline if I want to. Sometimes reps have a tight timeline that they can work with, like, hey, somebody really needs a training in the next 2 weeks. And if I don't have anything, then sometimes it doesn't work out. But again, it is a part of my career that I love. So I'm always willing to make it work and I'm always willing to travel. And I get a lot to see in these cool cities. So it's just an added
Yeah.
bonus.
And you said, like, going to California, you're gonna be there for how many days? So how many days are you gonna be there? And then in the span of 4 trainings, do they have them stacked back to back? And do you have time to kind of go and enjoy some sunshine and different things? Or
Much, but that's okay. So I actually have to look at my itinerary. I am training, let's say, I forget if it's a Tuesday, Wednesday, or Wednesday, Thursday, but I'll fly out the day before. I think I get in pretty late that night. The next day, we'll say it's Tuesday, I do 2 4-hour trainings. So I'll train from 9 to 1 and then 2 to 6. So it's all day. I'll go to bed that night, wake up the next day, 9 to 1, 2 to 6. And then I get on a red eye home. Yeah.
so you'll get to see lots of different clinics around California possibly, but not much sunshine, it sounds like, but you can go on another trip later.
Correct. Yes. I have, a list of places I want to go back to on a personal trip, but maybe I'll get to go to a nice dinner or a restaurant after the first day.
Yeah. And from a training perspective, what is your favorite treatment to train on and or like area to train on? Where is your love when it comes to training when you're like, "Oh, yes, like this account's asking for this area." You're like, "This is I love it."
Mhm. I'll speak from a Galderma standpoint first and then a private standpoint. With Galderma, because everything has to be on label, I love Sculptura. I do love teaching Sculptura. I think it's super underutilized. I think there's a lot to learn. I think it's an art, and a lot of providers are super eager to get great results and, move a little bit more towards that regenerative side of things. So there's a big push for it now. And patients are interested in it. Patients are so much more educated now and they're so discerning and they want natural results, and Sculpture does that. So whenever an account wants that, I get super excited. And lower, I love lower face. I'll never say I don't love lower face. From a private training standpoint, I do love temples. I love temples. Again, I think it's super underutilized. I think it's one of the most youthful areas that you can treat, although it is, high risk. So it just depends on the account. But I love diving into the anatomy. So that kind of fosters me to do that. So yeah, that those are my favorites. Everybody wants to learn lips too, which is fine. I love teaching lips, especially for newer injectors because there's a huge market for it. It's often the first area they want to learn and treat patients. So that's always really cool.
And for someone that either wants to attend a Galderma training with you or fly out and come to a private training with you, would you say that your training is geared towards somebody that has, a couple of years of experience? Because it sounds like, if you're doing more advanced areas like temples, lower faces, I would consider more of an advanced area if you really want refined results. So would you say, for someone that's like, "Oh, I wanna train with Gab," like, when would be the right time for me? Would you say, get your bearings, wait a couple of years, and then in that, like, 2 to 4-year window, possibly the best time?
Yeah, definitely. Candidly, am probably not the best person to teach you like how to hold a syringe and have really good like hand-eye coordination tips and tricks. I feel like I kind of thrive in more of like the results, how to elevate your results with minimal amounts of filler or how to assess a face holistically. So, yes, I would say get comfortable injecting, treat a few areas. It's okay if you haven't treated an area before, but yes, 2 years full time injecting is probably where my training would fall the most beneficial. I can make it super customized, but if I had to pick, that would be my preference.
I mean and if you wanna speak on this a little bit, I understand that. I love learning. I just haven't delved into the realm of training just for that specific reason of I think it would give me more anxiety to watch some of the learning take place in terms of like dexterity of holding the syringe and, learning how to navigate a cannula and not allowing it to dive too deep or superficial. And I think I don't know if I would be the correct person or you would have a really great experience as a new injector training with me. Does that make sense?
It does. And I think that's also where a lot of my passion for anatomy kind of falls into. So, if you know your anatomy, and of course, there's anatomical variation with every single patient, it's never going to be the same. It's never going to be the same as a textbook. But if you are very comfortable with anatomy, and this may be like a controversial take, but that kind of gives you the freedom sometimes to try things. Like you're never going to feel fully confident unless you treat a group of patients. Like you just have to put yourself out there. I remember when I first started and I was treating mid cheek with a cannula, I was thinking to myself, I don't really like feel comfortable doing this, but I just have to do it. Like I know my anatomy, so I'm aware of what can happen. I know my safer zones, I know my danger zones, and knowing the anatomy just makes you that much more comfortable and confident to be able to. I don't want to say experiment, but just go for it because at some point you have to, you really do. So yes, in training situations it's definitely a little like anxiety producing to see some of that learning, some of that like comfortability progress over time, but that's just part of the process. And that's why I do a pretty significant didactic portion first because I you can't really just put yourself out there and do, try those kinds of things without knowing what's underneath the skin in the area that you're treating. But yeah, I mean, with the Galderma trainings, you never really know. I mean, I've had providers that have never held a syringe before, and I have providers that have more experience than me. So it's a really wide range, and you never know what you're going to walk into. So yeah, the education, just like patient care, sometimes pushes you outside of the box and pushes you outside of your comfort zone, and it's just something you have to work with.
Do you have any patients that are like, absolutely not, I don't want a student or, anyone shadowing while you're doing treatments? Or for the most part, are all of your patients like, go ahead, I don't care?
Yeah, most of my patients are okay with shadowing. Yeah, I don't think I've ever had a patient not be okay with somebody watching and shadowing. I definitely have patients, as we all do, that are a bit more squeamish and don't really want to hear some of that anatomical language and bone
Yeah.
and so sometimes I'll give the shadows like a heads up, like, hey, let's just watch. Like, don't ask any questions. Maybe just hang back and watch, and we can debrief after the patient leaves. So it's just reading the room, but most of them are awesome and super understanding. And I have a lot that actually enjoy listening to the teaching component of it as we're treating them. So yeah, it's across the board.
Yeah, I feel so protective of my patients and like the relationships that we built that it's almost like I'm like, I feel like that would change and maybe
Hmm.
not. And maybe this is more of an excuse on my end, but I'm like, I don't know if I want to like change that dynamic of like having somebody else in the room necessarily.
Yeah, and sometimes we all have patients that we talk about really personal things with. It's like every time you see
Yeah.
them, you're checking up, but it's about something like super, super personal. So, yeah, you kind of have to look at the day and see if a shadow would fit in that day, and everybody's different. So,
So, going back to what you said earlier in the podcast, you were saying that in those 4 years where you were at your previous practice, you said you were investing a lot of time in, trainings and being the best provider that you could be. So, thinking back to that time, what were some of the trainings that were the most impactful to you? And for an injector right now that's in that, 1 to 4 years of their really trying to perfect their craft, what trainings do you recommend that they do?
yeah, it's tricky because trainings are really expensive and you do have to invest financially significantly in the beginning. And most of the trainings that I found to be super helpful were the ones that I was one-on-one, hands-on, treating models, not in a bigger group setting, whether it be observing or a conference or any speaker. Really intimate types of trainings where you are getting hands-on experience with a mentor are far beyond any kind of lecture I think you'll listen to, especially in the beginning when you are trying to, get your bearings and be comfortable treating areas. And so I did a couple trainings. I did one with Lori Robertson that I love, who did like a cannula boot camp. That was incredible. I trained with Denise Serrano. She was amazing. So those are just a few off the bat that I loved and I thought were really critical in kind of boosting my confidence.
I think everyone knows that both you and I had probably a different experience having a very close mentorship with another injector that had been in this space a very long time. Do you recommend for people to find a mentorship like that?
I do. I think it's really important to find a mentor. It's one of the, I mean, as we know, there's no formal education that goes through our nursing programs or your PA program or It's something that you kind of have to seek out your own residency. So it's really critical that you find somebody that has experience that can guide you through and has more experience than you. And it's not even about just injecting an assessment, it's complications, it's maintaining those patient relationships, it's your consult, it's your verbiage. So there's so much more that goes into creating a natural result and a beautiful result that you don't have super accessible resources to learn about.
Any tips or advice for those looking for a mentor? What to look for in a mentor? What to steer clear of? Any advice from that perspective?
Oh, that's a great question. I think find somebody that you align with their aesthetic eye because this industry, there's a big science component to it, but it's a lot of artistry as well. So everybody kind of views patients differently and their assessment skills are different and they approach patients differently. So find somebody that aligns with the results that you want to produce and the kind of clientele that you want to build up, and whether that be long-term results or there's an injector for everybody. So whatever your style is, find somebody that aligns with your style and kind of lean into that because that's going to be more valuable than learning from anybody and everybody.
Exactly. And for you now, where you're at currently, you are training other injectors. What types of trainings and what are you doing to continue to better your craft?
Great question. What am I doing? I am doing It's not so fun, but I'm doing more business stuff. I'm doing more complication management. I'm getting into ultrasound a bit. So I'm leaning into those areas that I haven't before that I think come with the responsibility of being a business owner. So I'm going that route right now. I trained with Maria Hawkins doing an ultrasound course with her, which was phenomenal. I was supposed to go to Dr. Subio's The Beautiful Nightmare with Codafana, but it got rescheduled due to the snow. I trained with Dr. Doan. So I'm leaning more into that side of things just to boost my confidence on the business end as well as in complication management because it is just me and I have my medical director, but it's really just me. So I want to feel a little bit more well-rounded in that aspect. So that's where my attention and my focus is for probably the next few months.
How did you feel? Was this your first ultrasound training that you did?
It was. It was.
How did you feel leaving the training? Was it just a day, a couple of days? Like, I know that ultrasound in general can be very, not, I don't want to say overwhelming. Like, what am I looking at? So, did you feel like somewhat confident after leaving that training, or do you feel like you have a lot of work to do still?
I did feel confident. And I think that comes from what I'm going to be using ultrasound for. I am in no way going to be a complication clinic, and I don't want that. Who knows again what the future holds, but for now, I know knowing myself, I'm a very needle heavy injector. So I love using needle. I love using needle in the lower phase. I love using needle in the piriform or the temple. So I wanted that ultrasound knowledge to be able to pre-scan and make my needle boluses safer. So I think kind of narrowing my focus on like this is what I'm using ultrasound for has made it more absorbable. I don't feel super overwhelmed because I'm not going to be treating patients that I didn't see that have granulomas or biofilms. And again, who knows what the future holds, but for now, that's my focus. So I feel like focusing on one thing at a time has been really helpful to gain my confidence in ultrasound. But yeah, that was my first course. And Maria is incredible. She is such an expert in ultrasound. So I would highly recommend her course to anybody. But yeah, it was one day. We did a lot of hands-on practice. She runs a complications clinic, so she's seen everything and anything. So yeah, it's a process, and I'm nowhere near an expert in ultrasound by any means, but yeah, there's a lot to learn.
That makes sense though. Again, you're scanning and you're like, "Hey, is the artery down on bone right where I'm going to inject?"
Yeah,
Yes? No.
exactly.
So, that makes it a little bit easier. So, 2 final questions, one being, did you train with Doan more recently within the last, like, year or so?
I trained with her, yes. It was last year, maybe March or April. So I was still at my previous practice, but within the last year.
In terms of guest, you're the only guest that I found now that has recently trained with her. So I trained with her back in 2022, I believe.
Okay. Yep.
But it's changed a lot since then. So when I was there, it was just me and one other injector and her. And I felt like I learned so much. I felt like it was a really great training. I know since then she's changed it quite a bit and there are quite a few shadowers there. So, how did you feel being there with multiple other injectors? Did you feel like you still got as much as you could out of that training?
Yeah, there was 6 of us, so definitely more than your experience, and it was in her older space. I think, like, her plan was maybe to increase the amount of shadows because she has the bigger space, but it was great. I didn't feel lost in the crowd at all. She was super attentive to all of us. I'm sure it was a similar format to when you went. So we saw her
Yeah.
inject, the new patient, and it was probably 6 hours, and it was super detailed, and we could all see and ask questions, and the patient was interactive. And then we sat and we were there. That was the night that we were there super late, but she went around the room. So it wasn't, there was one question and she asked the group, and whoever answered it, answered it. It was, she went around and got every person's answer. So she made sure that it still felt really intimate, even though it was a larger group. And I appreciated that. So, yeah, I don't feel like that took away at all from what she was teaching. And I thought it was awesome. And at the time, I wasn't a business owner, but I took a lot away from the training. And I can even go back to my notes now and find things that are applicable and still benefit from that training. I thought it was super valuable.
Yeah, when I had done the training as well, I wasn't a business owner, but very shortly after that, I ended up leaving and starting my own thing. And she was very, very helpful. Like, I think that in this space, there are a handful of people I've encountered that, will say, like, reach out anytime. Like, anytime you have a question, reach out. And then you reach out and you hear nothing. But she specifically, like, any question that I had, or I was like, hey, like, do you have a contact for this? She was very open to being like, this is the information I have. This is my recommendation. Reach out to this person. Like, she was very open with her information. And just, again, I really appreciated her taking the time.
Yeah, I feel like I mean, everybody has a different opinion and everybody benefits from different trainings. Her training is intense. I have a lot of, as I'm sure
Yeah.
you do, have a lot of colleagues that reach out and like, how is her training? Is it worth it? What's it like? I'm scared. It's intense. It's really intense. The first day, I think I cried, which is like fine. But I went home and I was so like overwhelmed with information of being like, oh my god, do I know anything? Which looking back was good, but she really wants all of her colleagues to succeed, which you don't find in this field very often. So I think I think it's great. I want to go back and train with her. So I got to plan that.
Yeah. Definitely tell people that personality wise, maybe she's not for everybody, but you really have to check your ego at the door and don't act like like you're going to feel like you know nothing. And you probably do know nothing compared to her, And so
Yeah.
coming from that lens and, not being too hard on yourself, but just being open to learning as much as you can, like, I think that's way more beneficial than going into it acting like you know everything. Because I think that there are a lot of trainings where you'll hear over and over and over, like, you're amazing, keep doing that. Like, you know everything. And that's not what's going to make you better. You need someone there that's like, you're wrong, or why are you doing that? Or, you know, really
Mhm.
questioning your thought process, because that kind of it will make you a better injector for sure. So,
Yeah, absolutely. She's super honest and blunt, and I appreciate it. It makes us all better.
yeah. And so my final question for you is, for those listening out there, what is your advice for standing out, as an injector in today's world? So one of them could be someone that wants to get into injecting and they're like,
Mhm.
how do I stand out? What should I do? The other injector, maybe they've been injecting 2, 3, 4 years and they're like, I've been injecting, but how do I level up? Or what can I do to stand out? Because I feel like I got into this space and it's maybe not what I expected, or I want more, but I don't know how to get there.
Yeah, that's a great question. I think it all starts with the patients. I think in this field, there's a lot that you can get into with social media and different companies, but I think your sole focus and the reason that we all do what we do is for the patients. So I think injectors that stand out are the ones who focus on intentionality, the long-term outcomes, and truly connecting with their patients. Again, patients are educated now. They are so much more discerning, and They're looking for providers who educate them, who listen to them, and who are really honest about what they do and they don't need. And that's one thing too that's changed for me over time, how much I value seeing patients in person. Earlier in my career, I did a ton of free assessments virtually based on photos that patients would send in. And I can understand from a business perspective how that can be a little bit more efficient and time saving, but you miss so much when you're looking at photos. And I know they're super common in aesthetics, and I still offer virtual consultations for traveling patients. You miss so much. You miss, muscular movement, and you miss skin quality, and you miss asymmetries, and you miss animations, and those things really matter. So now I really prioritize getting face to face with my patients whenever possible, and it allows for a really collaborative conversation, and it helps me treat the person in front of me rather than making decisions based off of an image. And ultimately, that leads to natural, more thoughtful outcomes. But to answer your question, I think standing out in 2026 really means getting comfortable practicing conservatively, spending time educating your patients, thinking in longer timelines instead of what can I achieve in a single appointment. The injector who doesn't overpromise and underdeliver is usually the ones that keep their patients long term. And that's where real trust is built and where your career is going to flourish. That's always going to go further 10 out of 10 times than the quick buck or the extra few $100s you might make on pushing a treatment that doesn't truly serve your patient. So that's for providers who are currently practicing. I would say for newer providers too, and I don't, again, maybe this is controversial, utilize your social media. Social media is so powerful and it brings so many opportunities, and use it to your advantage in the room as well. I mean, I do a lot of educational content, and I don't just do that for training purposes to get new providers to want to train with me. I do it for my patients too, because whether it's a new patient or an existing patient, if they watch my content and they watch my video, one, new patients feel like they know me. It credentials me and they know that, I'm knowledgeable and that I am continuing my education. So most of my consult is already done before they even get in the room. So they already are saying like, I know you, I've seen your stuff, I trust you, I've seen your results. Your social media is a reflection of your brand and your portfolio. So really spend time on that. And that's kind of nowadays the first impression that patients are getting of you. So take it seriously and put a lot of energy into it because I think it's really important, especially if you're trying to grow professionally. But yeah, I'll stop ranting. But yeah, that's my advice.
Lastly, tell them where they can find you, your practice, if they want to get in touch.
Thank you. My Instagram is at Gab Major, and my practice is May Aesthetics, spelled MAAE Aesthetics. And my handle for that on Instagram is only at May. But yeah, they can reach me on Instagram. I look through my DMs. So, I'm an open book.
Perfect. Well, thank you, Gab, for your time. I really appreciate it.
Thank you so much for having me.
Again, super amazed by some of the advice that Gab had for you guys. Love her intentionality that she has with what she's doing now. And I'm just so excited to see her succeed in her new role with May Aesthetics. So reach out to her if you have any questions. I would say you know where to find us, but I've changed everything. Podcast Instagram is at aesthetic.chathq. The website is aestheticchathq.com. My Instagram is at aestheticnurse.kiki. I'm also going to share a little bit more about my journey with opening a secondary practice in Scottsdale, Arizona. But until next time, beauties, bye.